হ্যালো ফ্রেন্ডস, আশা করি সবাই ভালো আছেন। অ্যাপ্লাই উইথ মি চ্যানেলে সবাইকে আবারও স্বাগতম জানাই। আমি বায়েজিদ হোসেন আছি আপনাদের সাথে। আজকে আলোচনার বিষয় আইসিডিডিআরবি এক্সামের প্রশ্ন এবং সমাধান পর্ব 2। 1 নং পর্ব যারা দেখেননি তারা আই বাটনে ক্লিক করে দেখে নিতে পারেন, অথবা ডেসক্রিপশনে লিঙ্ক দেয়া থাকবে। চলুন কথা না বাড়িয়ে মূল পর্বে চলে যাওয়া যাক। প্রথম পর্বে 1 থেকে 25 পর্যন্ত প্রশ্ন দেয়া আছে। Question 26. The common organisms responsible for pneumonia in 1 to 12 month children. Option A, Haemophilus influenza. Option B, respiratory syncytial virus, Streptococcus pneumoniae. Option 4, all of the above. Answer, all of the above. Question 27. Which parameter is not needed to assess dehydration? Option A, tongue. Option B, blood pressure. Option C, general condition. Option D, skin turgor. উত্তর, blood pressure. Question 28. While assessing daily fluid requirement, the following should be taken into consideration. Option A, all of the above. Option B, loose with stool and vomiting, sweating, urinary loss, respiratory loss. উত্তর, urinary loss, respiratory loss. Question 29. Which instrument is essential for basic life support? Option A, none of the above. Option B, pulse oximeter. Option C, stethoscope. Option D, infusion pump. Question 30. You have to start a blood transfusion for a patient. Which of the following is not important? Option A, identify the right patient, check blood group and cross matching. Option C, take informed written consent from patient. Option D, check patient registration number and blood bank number. Answer, take informed written consent from patient. Question 31. Which of the following is not a surgical cause of acute abdominal pain? Option A, intestinal obstruction. Option B, acute appendicitis. Option C, basal pneumonia. Option D, intussusception. উত্তর, basal pneumonia. নোট, প্রত্যেকটি প্রশ্নের উত্তর বিভিন্ন ওয়েবসাইট থেকে কালেক্ট করা। সেক্ষেত্রে ওয়েবসাইটের লিঙ্ক বা সোর্স নিচে ডেসক্রিপশনে দেওয়া থাকবে। নাম্বার 32, which one is a vaccine preventable disease? All of the above, hepatitis A, hepatitis B. উত্তর all of the above. Question 33. Which of the following is not usually a sign of dehydration? Option A, fever. Option B, dry mouth. Option C, reduced skin elasticity. Option D, sunken and dry eyes. উত্তর fever. Question 34. Which of the following is not a measure to be taken in case of fever? A, giving syrup paracetamol. All of the above, wrapping with blanket. Option D, tippet sponging. Answer, wrapping with blanket. Question number 35. What is hypokalemia? Option A, abdominal distension, edema, muscle spasm, cosmal breathing. উত্তর muscle spasm. Question 36. The single most effective means to prevent healthcare associated infection in hospital is? Option A, hand hygiene. Option B, periodic fumigation. Option C, prophylactic antibiotic therapy. Option D, use of PPE. Answer, hand hygiene. Tetany may occur by overuse of which IV fluid? Option A, normal saline. Option B, dextrose in normal saline. Option C, cholera saline. Option D, all of the above. Please answer in comment box. I have no answer for the question. Question 38. The major cation of plasma is? Sodium, B, potassium, C, magnesium, D, calcium. Answer, sodium. Question 39. In putting sterile gloves, which should be gloved first? Option A, no specific order. Option B, right hand. Option C, left hand. Option D, the dominant hand. Answer, the dominant hand. Question 40. Complication of diarrhea. Option A, heartburn. Option B, cramping leg pain. Option C, frequent micturition. Option D, hypoglycemia. Answer, hypoglycemia. Question 41. Which risk factor is associated with malnutrition? Option A, living in village. Option B, EPI immunization. Option C, no breastfeeding. Option D, rotavirus vaccine. Answer, no breastfeeding. Question 42. The chamber of heart that receives oxygenated blood from the lungs is the option A, left ventricle. Option B, right atrium. Option C, right ventricles. Option D, left atrium. Answer, left atrium. Question 43. Which drug is used in the treatment of tuberculosis? Option A, tetracycline. Option B, ciprofloxacin. Option C, amoxicillin. Option D, isoniazid. Answer, isoniazid. Question 44. Which intravenous fluids is or are recommended for rehydration in severe dehydration? Option A, all of the above. Option B, cholera saline. Option C, 5% DA. Option D, Ringer's lactate. Answer, Ringer's lactate. Question 45. Which of the following situation represents the best example of passive immunity? Option A, an infant receiving breast milk from the mother. Option B, a child receiving a vaccine for measles. Option C, production of antibodies by a person with infection. Option D, a person receiving antibiotics for an infection. Answer, an infant receiving breast milk from the mother. Question 46. Which of the following is not a common cause of convulsion in an 85 years old? Option A, male. Option B, hyponatremia. Option C, hypomagnesemia. Option D, hypoglycemia. Option E, hypokalemia. Answer, hyponatremia. যারা আমার ভিডিও এই পর্যন্ত দেখলেন তাদেরকে অসংখ্য ধন্যবাদ।